everyone! Welcome back to my channel and welcome to all new viewers. My name is Olka and I'm a UK-based vet, and today I'd like to talk to you about kennel cough. Before I get to it, please don't forget to like, subscribe and ring that bell if you enjoy my content. This allows me to keep this channel going. I aim to release a video every week. I also have an Instagram account where I post daily, so go and check it out. Without further delay, let's dive into the topic of this week's video then. Kennel cough is an infectious and highly contagious disease that is localized in the airways. Lots of different viruses and bacteria can cause this condition. Sometimes it's just one of them, sometimes a combination of multiple pathogens. Bordetella bronchiceptica is the most infamous pathogen that causes kennel cough. Some of the other ones include canine influenza and parainfluenza virus, canine adenovirus, mycoplasma and more. In complicated cases, secondary bacterial infection could lead to pneumonia. Luckily, in most dogs, the disease is self-limiting with resolution of clinical symptoms in about 2 weeks, sometimes more, sometimes less. Really, the disease can linger for anything up to 6 weeks. A good way to think about kennel cough is to compare it to colds and flu in people. Many different agents are involved. A human is more likely to get poorly if they or their family members regularly find themselves in group settings. Perhaps busy offices, supermarkets, schools, or other large gatherings. Just as dogs are more likely to get infected if they spend a lot of time with other dogs, for example training classes, doggy playgroups, or by spending time in, you guessed it, kennels. Kennel cough is easily spread from dog to dog through aerosol droplets, direct contact or contact with contaminated surfaces like food and water bowls or toys. Most people and dogs recover without antibiotics or supportive care. Some people and dogs, however, may develop pneumonia and require aggressive treatment. Both humans and dogs are more likely to become seriously ill if they are compromised in some way before infection. For example, if their immune system is weakened or they have pre-existing lung abnormalities, like chronic bronchitis. Sometimes, however, a particularly nasty strain of a pathogen can end up causing severe problems in even healthy individuals. So, what are the common symptoms of this disease? Affected dogs suffer from sudden onset of a cough. The cough can be dry or wet. It is often made worse by exercise, excitement, or pressure of the collar on the neck. When a vet examines a dog suffering from kennel cough and applies pressure on the trachea, otherwise known as windpipe, it easily induces a cough. Gagging, retching and nasal discharge can also be present. One of the most common complaints reported by owners I encounter when facing a dog suffering from kennel cough is owners worried that there is something stuck in their dog's throat and they sound and act as if they're choking and trying to bring it up. Some dogs become more lethargic and can develop increased temperature. A recent history, usually within the last 2 weeks of boarding, hospitalization, or exposure to a puppy or a dog with similar symptoms, is frequently reported. Puppies recently obtained from breeders, shops, kennels, or shelters have often been exposed to the pathogens. Uncomplicated cases of kennel cough are diagnosed on the basis of presenting symptoms during physical examination and history given by the owner. Diagnostic testing is indicated for dogs with systemic, progressive, or unresolving signs. Tests to be considered include X-rays of the chest, hematology, or culture to identify pathogens present, as well as obtaining samples for cytology to check what types of cells are present in the airways. How is kennel cough treated then? Uncomplicated, mild cases are treated with rest for at least 7 to 14 days, just like us humans would do if we suffered from a cold. If the cough is particularly bad, cough suppressants may be prescribed by your vet. Sometimes we would also use anti-inflammatory medications depending on how poorly your dog is. Remember not to use human medications as these can be toxic to your pet. Antibiotics are not indicated for most dogs with kennel cough for a couple of reasons. Firstly, the disease is usually self-limiting and tends to resolve spontaneously, regardless of any specific treatment that is implemented. And secondly, without culture, we don't actually know what pathogen caused the disease in a particular case. Therefore, we do not know which antibiotic would work, if any. In our day and age, globally developing antibiotic resistance is a serious issue, and we should avoid using them if at all possible. Sometimes, of course, antibiotics are needed, especially if secondary infection or pneumonia develops, but these cases are rare. The chances of your dog recovering from an uncomplicated case of kennel cough are excellent. How can you prevent your dog catching kennel cough in the first place? Minimizing risks of catching kennel cough include reducing your dog's exposure to pathogens causing this disease and by vaccinating. Also, seemingly trivial everyday things like providing good nutrition, routine deworming, and avoidance of stress all improve your dog's ability to respond appropriately to infection without showing severe symptoms. Bordetella, again the bacteria commonly responsible for kennel cough, may persist in the airways of dogs for up to 3 months following infection. Ill dogs or dogs with recent infection should be isolated from healthy individuals. Ideally, you should disinfect their cages, bowls, runs and toys, especially if you come into contact with other dogs. If you've got more than one dog, if at all possible, the healthy ones should be separated from the ill ones. I appreciate sometimes it is not possible though. Adequate air exchange is helpful in rooms housing several dogs. If you book an appointment at your vet's and your dog has symptoms typical for kennel cough, you might be asked to wait outside as not to expose the other dogs to the infection. What about vaccines? Do they exist? Are they effective? Vaccines against some of the pathogens causing kennel cough do exist, but not against all of them. As there are many different strains of the pathogens, it cannot guarantee full protection. But at the very least, getting your dog vaccinated should lessen symptoms if they become infected. Although protection is not guaranteed, many boarding kennels require dogs staying with them to have the vaccine. Currently, the vaccine comes in the form of a nasal spray. I'm afraid lots of dogs don't like it, and sometimes it can be a challenge to administer it. I am sure any owner with a dog regularly getting this vaccine knows what I'm talking about. It can be a battle. It is important to note that your standard yearly booster does not protect against kennel cough, so you will need to make sure you ask for kennel cough vaccination specifically. Currently, it is considered a non-core vaccination. Non-core vaccinations are vaccinations against the diseases that have a low mortality rate or can be treated effectively, as well as the ones that only affect specific populations as a result of their lifestyle or geographical location. Because it is a live vaccine, it is possible that your dog might develop mild coughing following the vaccination, although this doesn't happen very often. The vaccine needs to be repeated once every 12 months. Onset of immunity is 72 hours against Bordetella and up to 3 weeks against canine parainfluenza, which basically means that the vaccine needs a few weeks to provide some protection. Vaccinated animals can spread the Bordetella bronchiseptica vaccine strain for 6 weeks and the canine parainfluenza vaccine strain for a few days after vaccination. Several weeks ago, I made a video about core vaccinations given to dogs in the UK. If you want to learn more about it, I'll put a link to the video in the description below. So let's go back to kennel cough. Can your dog get kennel cough more than once? The answer is yes. Again, as there are many different pathogens and strains causing this disease. Can humans catch kennel cough? So most of the pathogens causing kennel cough can't be passed on to humans. However, the main bacteria, Bordetella bronchiseptica, unfortunately has the potential to infect immunocompromised humans. It happens very rarely though. For that reason, immunocompromised individuals should avoid contact with the vaccine and vaccinated dogs for up to 6 weeks after vaccination. Having said that, I think we are coming to the end of this video. Finally, the decision of getting your dog vaccinated against kennel cough isn't black and white, and it really depends on your and your dog's individual situation. If you still have doubts, consult it with your veterinarian. They'll be able to help you. I hope I helped you understand this disease better and you found what you were looking for in this video. And lastly, thank you for watching. I hope you liked my video, like, subscribe, and I hope I'll see you here again soon. Bye!